In history, in service, in sisterhood, in the community with Tau Omega.
Welcome to another episode of In the Community with Tau Omega. I am Andrea Webster, a member of the Mental Health Committee for Tau Omega chapter of Alpha Kappa Alpha Sorority Incorporated. October 4th through the 10th is Mental Awareness Week. The Tau Omega chapter of Alpha Kappa Alpha Sorority Incorporated is working with the New York Metro chapter of the National Alliance on Mental Illness, or NAMI, to educate the community on this important topic. Our organizations have partnered together for the next 4 years in order to decrease the shame and stigma in the African American community on mental illness. If you need further resources after watching this video segment, please contact NAMI Helpline at 1-800-950-6264 or visit the website at www.nami.org. Today we'll be discussing mental illness, focusing on depression. Our guest today is Dr. Karinn Glover, a psychiatrist on staff with the Montefiore Medical Group. Thank you for joining us today. Please tell us a little bit about your background.
Sure. So I'm delighted to be here. I am a psychiatrist at Montefiore. I am also part of the faculty. I'm an assistant professor of psychiatry and behavioral sciences at the Albert Einstein College of Medicine in the Bronx.
Nice.
I was born in the Bronx, and so I'm back where I came from. I also attended Howard University, so I'm a proud alumna, and I am also a member of the Alpha Kappa Alpha Sorority Incorporated.
Well, welcome, and thank you for being here today. So now we're going to address some questions on depression, which I feel you're kind of a guru in this area. So my first question to you is, what is depression?
Depression is a mental disorder. Essentially, that means that certain neurotransmitters may be out of balance, or there may not be enough of them, and the effect of that can be low mood for over 2 weeks. It can be hopelessness, feelings of guilt, feelings of worthlessness, and sometimes even thoughts of hurting oneself and thoughts that one would be better off dead.
Wow, so then what is the difference between depression and manic depression?
So in order to talk about manic depression, I have to talk about mania.
Okay.
So mania is 7 days or more of basically chaos, where a person is talking fast and thinking fast. They're doing things they would never do ordinarily, taking extra chances with their life, spending money they don't have, thousands of dollars sometimes. It can also mean that the person is convinced that they are a CEO or the Messiah. And so there's these notions of grandeur, a sense of agitation, and the person doesn't feel the need to sleep. So 1 or 2 hours and they're done for the night, and they have a sense of needing to sort of keep going and going and going.
Wow, so then how is depression diagnosed?
So depression can be diagnosed by lots of different health professionals. So some people can go to their primary care doctor's office, and a nurse will ask them, how have you been feeling lately? Are you sleeping? Are you feeling hopeless? Does life still feel interesting and good for you? So they can also see a social worker or a psychologist or a psychiatrist, and the diagnosis can happen that way.
Wow. So is depression treatable?
Absolutely. The great part is that there's different ways to treat depression. So there's exercise and diet. There's seeing a professional for psychotherapy on a weekly basis. There's also medications if that's what's needed and if that's what the person wants.
Wow, okay. So what are some signs a family member should look out for someone who has been diagnosed with depression?
So we rely heavily on family members and friends to help people get the help that they need. So people can look at the person they love, and if they notice a change in the person's sleeping habits, either sleeping too much or not enough, if the person is eating too much or not enough, with weight loss or significant weight gain, those are sort of red flags. If the person is starting to talk about not having the future that they envision for themselves and feeling hopeless and feelings of guilt and shame, those are things that we really pay attention to. And then, of course, when the person starts to talk about hurting themselves and even buying a weapon,
Wow. Okay.
those are things that we really rely on people to let us know
Okay.
to keep the person safe.
Understood. Okay. So is depression hereditary?
Absolutely. For lots of people, if they have a relative, like a first-degree relative and mother, father, sibling with bipolar disorder and bipolar depression, implicitly, they have a much higher risk of having depression themselves. If they have a relative with simple depression, they also are at higher risk. But they are also at risk because of environmental factors.
Okay.
We know things like poverty, extreme poverty, multiple life stressors at once, marriage, divorce, the death of a loved one, losing one's job. All of those can precipitate or trigger a depressive episode.
Oh, okay. Oh, wow. So my next question to you is there a cure for depression?
I wish. So for lots of people, when they have their first episode of depression, we try to advocate for them getting treated either through psychotherapy or through medications. We know that after the depressive episode wraps up, that they are at 50 to 60% risk of a recurrence of depression.
Wow.
So we try to do what we can to prevent the next episode, and if that doesn't work, then we know that that person should probably be on medications again, because each episode of depression has an effect on the brain's architecture. And that means that the person could be at risk for another episode of depression that's even worse and harder to treat, and it might last longer.
Wow. Okay. Wow. So being bipolar, because you brought that up, is that a part of depression?
So some people with bipolar disorder, they go between what we call mania, this talking fast, thinking fast, and taking lots of chances with their life. They go between feeling like that and then feeling normal. And then there are some people who go between feeling normal, manic, and then very, very depressed. And one of the things that we are very concerned about in the healthcare profession is when somebody is dealing with bipolar depression, feeling that agitation, because that sense of agitation is often linked to suicide or hurting other people. And so bipolar people can get depressed. People with what we call unipolar or just the average depression obviously are dealing with depression and depressive symptoms themselves.
Wow. Okay. Well, thank you. Thank you for your time today. Thank you, Dr. Glover.
This has been my pleasure.
It has been my pleasure as well. And thank you for watching another episode of In the Community with Tall Mega. For more information, please visit our social media pages and our website. Thank you and good night. Welcome to another segment in the community with Tall Mega. My name is Andrea Webster, and I'm a member of the Health Committee for the Tall Mega chapter of Alpha Kappa Alpha Sorority Incorporated. Today we will be discussing mental illness, focusing on schizophrenia. Our guest today is Dr. Pierre Richard Arty, a psychiatrist practicing in Brooklyn. Thank you for joining us today. Please tell the audience a little bit about yourself.
Well, thank you very much. It's an honor to be here. I'm very happy to be here to discuss mental illness, specifically on schizophrenia. I attended college at Columbia College, where I did a political science concentration in pre-med. So I did a combination of both things because I enjoy politics and I also enjoy medicine. Subsequent to that, I went to SUNY Medical School, SUNY Downstate Medical School in Brooklyn, New York. So I returned to Brooklyn and I completed a residency in both medicine and psychiatry in Brooklyn. And subsequent to that, I did a fellowship in substance abuse, addiction medicine. So that's my sweet spot. addiction. So I'm happy to be here.
Well, it's a pleasure, and you sound very well versed. So today I'm going to ask you a series of questions on schizophrenia. And my first question to you is, what is psychosis?
Psychosis. Now, that's an interesting word that starts with a P, not with an S. By psychosis, we mean that an individual's sense of reality is different not only from yours or mine, but from the majority of persons. It could be expressed in many different ways. For example, somebody can have a problem with their thought content. What they're thinking could be just totally off the wall. An example of that, if I say to you that I am, and this is an example of a delusion, which is a specific manifestation of psychosis. If I say to you that I am Spider-Man and you say that I'm not, and I try to climb up the wall and I fall, and you say, see, Dr. Arty, you're not Spider-Man, and I actually look at you and I say, well, you've just negated my Spidey powers. Well, that basically shows that I have a fixed thought, a fixed belief that is specific to myself, and nothing can really change it. There are many things that can cause psychosis, and it's not just, as we will be speaking about schizophrenia, it's not just that mental illness, but sometimes people who take various drugs, for example, cocaine, sometimes just withdrawing from a drug, for example, alcohol, can lead someone into a place where their thought processes are affected and their thought contents are affected to the point where they're not thinking right, they're not thinking straight, and they are having just some incredibly strange beliefs. Paranoia is another element of psychosis, or another expression of psychosis. So many things can cause psychosis, and it's not a good thing. Okay.
Well, thank you for that question. Ma, but I have another question for you. What is schizophrenia, and what is schizoaffective disorder?
Okay, well, interesting questions. We'll start with schizophrenia.
Okay.
Long word. Schizophrenia is essentially, it's a brain disease. Now, throughout the years, many persons have come to defining it in many different ways. Some people in the past have even attributed it to spiritual forces. But we have found out through research that it is a brain disease, and the brain is an organ like the heart or the lungs. And so as the heart can be affected to the point where, let's say, you have a heart attack, or the lungs are affected to the point, let's say, you have asthma or emphysema, the brain, being an organ, can also be affected when its own neurotransmitters are not aligned properly or not doing what they should be doing for whatever reason. As I mentioned before, drugs can be a reason that can affect the neurotransmitters. Now, with schizophrenia, which we don't know exactly the cause of it, but we know that there are genetic components involved. We know that stress is also involved with schizophrenia. We don't know if drugs can cause schizophrenia, but certainly it can unravel, it can expose it. So it is a mental illness that's manifested in different ways. The thought content, as I mentioned before, with delusions, strange false beliefs that are fixed. You can also have individuals who are schizophrenic who can start having what is referred to as perceptual disturbances. And that's where their appreciation of reality becomes skewed, so they can begin to hear voices or see things that other people don't see. And the voices, and I'm not talking about voices that we're hearing outside in the community, but we're talking about voices in someone's head telling them something. Or it may not even be voices, it may just be whispers, or even just sounds that an individual may experience. So those are perceptual disturbances. But the schizophrenic manifestation is not limited to that. You can also have individuals who behave in a bizarre manner. So the behavior, or even speak in a bizarre manner. And there are many different expressions of that type of speech abnormality, where a person can speak with you and they're not even making sense. So those are all types of manifestations of schizophrenia. There are also those who have movement disorders. And if I can speak just a little bit more about schizophrenia, there are even subtypes of schizophrenia, where individuals who can be paranoid, with a prominent manifestation, or the predominant manifestation is paranoia. And then there are those who have abnormalities, where schizophrenia is physical abnormalities, where the schizophrenia is expressed in terms of movement abnormalities. Some people just kind of stand there, they call it the catatonic type, or they're very agitated. And then there is the worst the worst prognostic schizophrenia is the disorganized type.
Okay.
And this type, unfortunately, can result in somebody being on the streets and just acting really bizarrely and just really not doing very, very well. And they're the hardest to treat.
Okay.
Okay, I hope that was helpful.
Yes, that was very, very helpful. Okay. So my next question to you is, should we be afraid of people with schizophrenia and and psychotic disorders?
No, we should not be afraid of individuals with schizophrenia. As I would think of it, should you be afraid of somebody who has a heart attack or who has a high cholesterol? It is an illness which we should treat. Now, the question that you're asking certainly hints to the fear that individuals with schizophrenia are criminals. And that's a false misperception. Many times that type of association is made, and that is just not proper. Criminal acts are made by individuals who are criminals. Individuals with schizophrenia or psychotic disorders have an illness which needs to be treated. Certainly at times the illness may cause somebody to perform or do something that normally they would not. But the first and foremost thing is to get these individuals treatment.
Right. Okay. So I have another question for you.
Okay.
Are there medications that can help people with psychotic or psychotic disorders?
Yes, there are medications. There are many medications. There are what is referred to as antipsychotics. And they have gone through several generations of antipsychotics. These medications affect the neurotransmitters in certain places in the brain, and people have found out that the excess of one type of neurotransmitter may lead to a psychotic event. For example, there are certain drugs like cocaine that can cause one neurotransmitter, dopamine, to be expressed in an abnormally high volume in the brain, and that can lead someone to experience psychotic type of phenomenon or manifestations. So these medications cause a suppression or a balancing of these neurotransmitters, and they are very, very helpful. I would say that anyone who is experiencing a psychotic phenomenon should receive help as soon as possible, because the longer the brain stays in that state, the worse it is for the individual, the worse the prognosis. So yes, there are medications. There are, beyond medications, there is also therapy for individuals who have these types of experiences, because after this, the psychosis subsides, certainly the individual would benefit from having a place where they can essentially discuss the experience, whatever they may have recalled or whatever they may recall of the experience, and to receive some reassurance that things will improve.
Gotcha. Okay, very good. So I have another question, because you've brought this up in your discussion about schizophrenia. Can drugs or alcohol affect psychotic disorders?
Clearly, drugs and alcohol can affect psychotic disorders.
Okay.
I would say, as a physician, that anyone who is experiencing psychotic phenomenon, for whatever reason, it could be genetic, it could be due to stress, the intake of drugs and alcohol is just not a good thing, because the drugs and the alcohol do also affect the neurotransmitters, causing abnormalities of neurotransmitters in the brain, and can maintain a psychotic state or make a psychotic state even worse. So when I give individuals, or when I prescribe individuals medications, I clearly, if they have a history of substance use or substance dependence, what I say to them is that I would not recommend taking what I'm giving you with any other drugs, because it just messes up the works.
Understood. Yes. So I have a follow-up question to that. So with the individuals who are abusing substances, and they're using it because it says it makes them feel better, how do you tell them that it's not actually?
Not actually making them feel better?
Correct.
Well, they're the ones who are experiencing the feeling. So they may very well, and they have a good argument. Doc, this makes me feel good.
Right.
Well, I can bring to their attention that in addition to what it makes you feel, you have to understand that it's doing something to your brain that is not the very best thing for your brain in terms of affecting your neurotransmitters. And maybe you may want to consider something that may not give you a buzz or a high, but may very well allow you to think clearly for a certain period of time. So that way I can provide a counter argument to the doctor. It makes me feel good.
Okay. Because I find that, you know, most people who may have some type of disorder rely on drugs and alcohol to kind of, I guess, make them not feel whatever they're feeling at that time.
Right.
So that's why I wanted to ask that question.
Well, it's true. And part of the treatment is getting to the underlying, well, how is it that this makes you feel good? Is there a feeling that you're lacking? Is there a bad feeling that you don't want to have? And so this is preventing the bad feeling from taking place. So it's not just the medications, but it's also the therapy that is involved with that. If the individual, and a great percentage of schizophrenics also suffer from depressive disorders. So if the individual has a depression, then it's important not just to treat it with the antipsychotic, but to also address the not feeling good phenomenon. If it's a depression, let's talk about it.
Understood. Okay, great. That was wonderful. So my last question for you, are there any natural remedies that can be used in the treatment of psychotic disorders?
Well, you know, that is a very interesting question. And what I can say is that with the schizophrenic event, it would be best to avoid certain things, not so much the natural remedies, but to avoid certain things that may cause a schizophrenic event or a psychotic event to become worse. For example, we mentioned drugs and alcohol. Another thing is getting sufficient rest, because these things minimize the stress that is on the brain. And also, there's an old theory referred to as, it's got a big name, called the stress diathesis theory, having to do with the possibility that stress may cause underlying psychotic illness to be manifested. So what I would say is that it would be best for individuals who have or who are prone to psychotic phenomenon to try as much as possible to avoid stressful situations, which means that it would be good for individuals who are experiencing this to have a network of friends, family, therapists, the doctor, whomever it is, to help them negotiate very stressful events in life. Events such as loss. I once had an individual who wound up in the botanical garden pond over at Prospect Park. And the reason is because he had witnessed his dog getting hit by a car. That caused him to become psychotic. That was a stressful event. And he was prone to psychosis, not knowing it, but this caused him to just go into another place in his brain or in his mind. So stress is a very, very, very active component pertaining to schizophrenia. And as much as we can in the community help to minimize the stress that is upon an individual, I think that would be beneficial to the person.
Wow, okay. And I know I said that was my last question, but you just kind of made a little buzz in my head, and I wanted to know, with regards to you saying a stressful situation affecting someone and then they're having like a break, does that person have like an underlying type of illness already present for that to actually happen for them?
It may be. We don't know exactly. But what I can say is that each of us appreciates or negotiates or handles stress differently. For example, you may be of such stern stuff that you and I may be exposed to the same stressor, but you handle it so much better than I. And the reason why I may not be able to handle it so well is because of, let's say I had some type of anxiety disorder in my family background. There may be a genetic component within me that I'm not aware of. That kind of hampers my ability to handle so much stress. Or maybe I was exposed to such a stressor in the past that the second time around, I'm just not handling it that well. I didn't learn from the last lesson or the last stress. So there are many reasons why or how it is that individual who may be prone to psychosis doesn't handle stress well and becomes even more psychotic. So the bottom line is to minimize stress.
Understood.
By eating well, sleeping well, and hopefully getting enough exercise.
Wonderful. Those are great answers, and hopefully everyone would try to abide by those rules and regulations. Well, that's our time for today. Thank you, Dr. Arty. It was a pleasure having you in our studio. And thank you for watching another episode of In the Community with Tall Mega. For more information, please visit our social media pages and our website. Thank you and good night.